Hello and welcome to Virtual Face-to-Face with Dr. Bruce Jarrell. I'm Alex Lakowski, Executive Director of Media Relations. Today, Dr. Jarrell will examine the response to COVID-19 here in Maryland and across the country and look ahead to reopening the state and what that might mean, the balance between testing and tracking and financial necessity. His guest today is uniquely qualified to explore all of those topics. Professor Michael Greenberger wears and has worn many, many hats. Today, he is Director of UMB's Center for Health and Homeland Security, which he established in 2002 as a nonprofit group and academic center committed to maximizing organizational resilience before, during, and after an emergency event. He's also a professor at Carey Law, where his repertoire of courses includes law and policy of emergency public health response, law and policy of emergency management, and much, much more. Prior to coming to UMB in 2001, Professor Greenberger had a very accomplished career in private practice in Washington, D.C. For that, he took a position with the before taking a position with the Federal Commodity Futures Trading Commission, where he led the Division of Trading and Markets. He served on presidential and United Nations commissions on financial markets. And as the Justice Department's principal deputy associate attorney general, he oversaw work on civil rights, environment, antitrust, and tax issues. And his work at the Justice Department also included projects involving law enforcement and public health policy. So welcome, Professor Greenberger.
Thank you, Alex.
And before we begin, let me say this program is being recorded and will be posted on our COVID-19 website, umaryland.edu/coronavirus. A little later in the program, you, the audience, will have a chance to ask questions or make comments. Here's how you do that. Look for the tools at the bottom of your screen. They're all enclosed in circles. Click on the button with the speech bubble to open up the chat function. Type your question there. When the time comes, we may call on you to ask your question. So please listen for your name and be ready to speak up. I'll do my best to give you a heads up by sending you a chat message in return. So please look out for that too. With all that out of the way, here's our host, UMB Interim President, Dr. Bruce Jarrell.
Good afternoon, and Professor Greenberger, thank you for being with us. As you can see, we're all sitting in our homes yet again. It's been another week of being sequestered away at home, managing our university affairs and our educational things at home. I'm getting better at it, although it's still not my first nature. I won't say it's enjoyable yet, but it's getting more manageable. We're pleased to have Professor Greenberger with us because his expertise, particularly in health and homeland security, goes deep and wide. And there are a number of things that you may have seen in the popular press about topics that he has a lot of expertise in. So what I would like to do is to begin by, in addition to thanking him, ask him to make a few comments about his Center for Health and Homeland Security and a little bit about what they've been doing over the last couple of months with this COVID pandemic. Professor Greenberger.
Thank you, Bruce. First of all, I need to thank you for being such a good friend to me and the center over these years in your various capacities, and compliment you on what a great job you've been doing for the university during this crisis.
Thank you.
Shortly after the 9/11 attacks, I was approached by the then president of the University of Maryland, Baltimore, Dr. David Ramsey, about starting a as yet fully not developed center within the president's office. That came to be the University of Maryland Center for Health and Homeland Security. On May 15th, we will celebrate our 18th anniversary. We have over 25 professionals on staff, and our expertise is advising public and private institutions on how to respond to crises, whether it be terrorism, superstorms, pandemics, as we are experiencing now. And we've also developed an expertise in cybersecurity, and we have graduate school courses supplementing the work we do in the field. At this point, obviously, the pandemic fell right into our wheelhouse, and our staff is working long and hard hours supporting local public health agencies, many in the state of Maryland and in the District of Columbia, in developing their responses to the COVID crisis. The most fundamental thing is every one of these health agencies or offices of emergency management have joint operations centers, which are like war rooms. And my staff is sitting in those centers in person. This is not remote. And they're doing 12-hour shifts 7 days a week. And they're essentially anything that comes along that needs to be done to support the response to the crisis. And let's call the principal clientele we have is Montgomery County, Prince George's County, Baltimore City, the District of Columbia. My staff assists in providing that help. And I might quickly add that under the University of Maryland, Baltimore, there is similarly a emergency management operations center under the emergency management director, Jonathan Bratt, who's done a fabulous job. And we've been giving support to that operation as well.
Right. So it always struck me odd that a law school and a law school professor would be so fundamental to emergency preparedness and all of the things that go into responding to a pandemic or some other disaster. So why is law so fundamentally important in this process?
Well, it's a great question. First of all, I should say quickly that our staff is not just lawyers. We have masters of public health, masters of public policy, masters of Homeland Security. But the great bulk of our staff are lawyers and lawyers who graduated from the Carey Law School. And I should say over these 18 years, I've had over 100 alumni work with us and then go on to important jobs in this field. But the whole area of emergency response, first of all, it's filled with laws you have to comply with, regulations you have to comply with, best practices you have to comply with. So it's very important when you do this work, you must, or whoever's in charge of it must know whether what they're doing is in compliance with the law. And secondly, there is it has become an art form, not a science, but an art of how institutions organize themselves to respond to emergencies. Simply put, it's called the Incident Command System. And our staff are expert on how that infrastructure is set out and how it works during emergencies. And I should add that we teach courses both to lawyers and non-lawyers on these subjects. So it has turned out that I know when we started, people say, what does a lawyer have to do with this? But 18 years later, it's now well accepted that there is a role for lawyers in both the law and policy of emergency response.
Right, thanks. And you got involved earlier with coronavirus and the SARS outbreak. How were you involved in that?
Well, it's an excellent question, Bruce, and it's not just SARS. We've gone through SARS, MERS, swine flu, bird flu, Ebola, Zika. Every time these pathogens raise their ugly head, we are called upon by groups both nationally and internationally. And in Ebola, we were advising West African countries that were the epicenter of Ebola about how they should respond, how they should organize themselves to respond to these crises. Let me be quick to say that we have never experienced an all-out, full-court press the way we have with COVID-19. It has called out every resource that we can imagine. And quickly, let me say that we consider ourselves expert on the law of how you respond to an emergency. And for dozens of years, we've taught this hypothetically. The COVID-19 experience has made these legal issues come front and center. We are going to have to rewrite our syllabi to teach this. So this has been a full court press, and it's required us to use every resource we have available to help our clients.
So if I'm the Prime Minister of Liberia and I have 20 Ebola cases and I'm worried about Ebola in my country. How can you help me? I'm many thousand miles away, and you don't know me. So what could you do there?
Well, we have a cooperative agreement with the State Department, and the embassy in Liberia would get in touch with us. They may have us give advice remotely. There have been times when we've been called abroad. I had personnel going to Pakistan in times where Pakistan was not the safest place in the world to be. But everything we know about how to organize, how to set up vaccine clinics, how to do hygiene, a whole panoply of weapons that need to be used. We have the playbook. We've used the playbook, and when we're dealing with 4 West African countries who got hit by Ebola, we not only went there, but they came here to get guidance.
Right, and I remember when we had Professor Samba Sow, who was from Mali during the Ebola crisis, talking about borders, and he had this favorite picture of mine where he showed the border between Mali and I forget where it was, the next country over, and it was like a fence gate, and it was wide open, and you could walk right across it. There was no border there except on paper.
Yes, and also today we see in the COVID experience, policies that are adopted in the state of Georgia are going to affect the state of Florida. We don't have in the United States borders, and that's obviously a problem in terms of providing remedies.
Right. So more to the COVID point here today. You have a lot of experience with the law and regulations as it applies to nursing homes. And I know that goes back at least to Hurricane Katrina. Could you tell us a little bit about what happened at Katrina that got things started? And then where are we in the state of regulation and monitoring this particular issue in nursing homes?
Well, it's almost trite to say, but as bad as COVID-19 has been, nursing homes are an epicenter. And when you are talking about big cities that are epicenters themselves, you're talking about epicenters within epicenters. Bruce, you and I looked earlier today, and 1 out of every 2 deaths from COVID is in a Maryland nursing home.
Right.
A nursing home, going back to Hurricane Katrina, when this first became an issue, when the mortality rates were assembled, and we know many people died in Hurricane Katrina, but it's little known that 70% of those deaths were from nursing homes. Why? Because nursing homes, they were unable to rally the patients in a way that would get them out of harm's way. It's a bit of a different problem now because the way nursing homes are operated, if social distancing is helping us beat this virus, nursing homes are the exact opposite of an environment for social distancing. People are crowded in one space. The personnel who are taking care of residents are crowded. So this has become a big concern nationally because of the serious impact nursing homes have had. This has been a point of great frustration for me and my center because in September of 2016, the Obama administration passed regulations requiring nursing homes, and for that matter, all long-term living facilities, to have emergency operations plans to train personnel and test personnel on dealing with crises. One of the things that should have been addressed, and if it had been enforced, would have been addressed, is how nursing homes would relate to a pandemic. The regulations were to go into effect in September 2017. We were fully prepared. Not only, most of our work is done on a fee-for-service basis. Our operation is 90% funded from the service work we do. But on that issue, we knew we would have to provide pro bono work. And we waited a year, and a year when the rules went into effect for an influx of nursing homes, coming to us for help, but the rules adopted were never enforced. That's a little known fact in this crisis. Had those rules been enforced on the day they were supposed to be enforced in 2017, and obviously we had a change of administrations between the time the rules were passed and the times they had to be implemented, I can't tell you that we would have had a complete victory, but I feel confident that if nursing homes had plans, training, personnel, and exercises, that the terrible toll we see now would have been cut by at least 1/3 and maybe as much as 1/2. So we know, and we see it in the state of Maryland, Governor Hogan has admirably put a lot of attention on the extraordinary number of deaths. And we've had strike teams. Yesterday, he just announced that every resident or personnel in a nursing home will have to be tested. He has certainly put his shoulder to the wheel to mitigate this, but this problem was known a long time ago. And at least 3 years ago, rules went into effect, which, if complied with, would have substantially undercut the tragedy we're now seeing.
All right, so those were federal rules, I take it.
Federal rules, HHS, Department of Health and Human Services. And they did it because every major crisis from Katrina going forward, Superstorm Sandy, any biological pathogen, that nursing homes always came out worse for wear. They stood out like a sore thumb. So the thinking was, we have got to put a lot of attention on this subject, and it was never brought to bear.
So with nursing homes and a pandemic, I can understand it. It's obviously, it's close quarters and a disease can spread very rapidly. In a situation like Katrina, what was the critical factor that caused so much deaths there?
They just couldn't evacuate patients. Patients needed to be evacuated. That was true in Katrina. It was true in Superstorm Sandy. They just did not have the organizational ability to move so many patients out of harm's way. And when I say a lot of nursing home patients died, they died in their beds because there were no plans. To respond to an emergency, you have to have emergency operations plans written well in advance. And then you have to train personnel on how to implement those plans. And then you do exercises to ensure that the plans work. None of that has been done.
Right. I just want to remind the listeners, if you've got questions, please type them in because we'll have some time for Professor Greenberger to answer those shortly in the program. Let me move to a little bit of a different topic here then, and that is, I know you've had some commentary on the powers of the governor and how they've been exercised during this pandemic. Could you comment a little bit about that and what your thoughts are?
Yeah, I should say that we've been studying these issues for over a decade, well over a decade. And as we're seeing, because this is an unusual situation, usually if there's a bad hurricane and a federal disaster is declared, it's one governor, two governors operating, and their powers don't come up on the radar screen. Now we've got 50, if you count the District of Columbia, 51. If you count the territories, even more. The emergency is simultaneously hitting everybody at the same time. It is a little known fact, first of all, as a constitutional matter, the health and safety of citizens is expressly afforded the states and the governors by our Constitution. If the federal government wants to do something, they got to find a specific reason within the Constitution to do it. But the governors are front and center in a health crisis like this, or a hurricane, wildfire, whatever. It's their job, it's their resources, it's their training. So these problems, and the problem of the pandemic is principally that of the governor. within every state, and the laws vary in detail from state to state, there are legislative powers afforded the governor once the governor declares an emergency to go to a full court press in doing what needs to be done to meet the emergency. I remember at the beginning of this emergency, Governor Hogan was shutting businesses, and I was getting calls saying, oh, I own a business. Where does the governor get off closing my business? I have a constitutional right to run my business. And the answer is no. As long ago as 1905, in the landmark case of Jacobson versus Massachusetts, the Supreme Court said in that case, it was smallpox, a form of pandemic, that you don't only look at the individual's rights, you look at the community's rights. And the community's rights in this kind of situation overwhelm the individual's rights. So the governor, our governor, Governor Hogan, as well as many others, are operating under state statutes, doing extraordinary remedies. The lockdowns we're experiencing is basically a state-initiated operation. There's federal guidance, but it's the governor's responsibility. They must do this. They have the power to do it. And what we have never seen before and are seeing now is that the governors are resorting to the laws to enforce what they've done. So people, even in the state of Maryland, I think there are 100 citations that have been issued by the state police, local police, and in an emergency, it might be the National Guard, for people who are violating what the governor wants done. What does that mean? That's a federal criminal violation. It's serious business. And Governor Hogan and many other governors, for example, governors who see these massive gatherings on beaches, they are having to, for the first time in a major way, resort to law enforcement to say, in effect, look, I'm just not telling you this. I am going to enforce this. And if you don't do it, you are going to have to answer to the law. So in the state of Maryland, there's a very unusual, not well-known statutory provision that gives the governor the power to interfere with any other law that prevents him from responding to the emergency. I remember we told this to our highest court in Maryland, maybe 10 years ago, the Maryland Court of Appeals, and the judges, their jaws dropped. And I think some of them were saying, well, that may be the statutory law. I don't know if we're going to enforce this. But I can tell you, we see in the worry and problem of this pandemic that the courts are going to, if they're called upon, go a very long way to support our governors.
So he's taken a lot of actions, and I think what I just heard you say is that he's well within his bounds and acting very properly.
He is well within his bounds, and I would say the Maryland Attorney General, I don't want to get too heavily into politics. We got a Democratic Attorney General, a Republican governor. They often don't agree, but on this subject, our Attorney General has foursquare said that the governor is acting within his powers. Now, they've said it informally. I'm sure if that had to be a position in court, it would be taken. But in our state, there's no politics about this. Everybody wants the best minds to put their shoulder to the wheel to solve the problem.
Great. Okay, I know we have a few questions. It's about time for questions. Alex, do you have one teed up for us?
Well, I do. I have a couple of questions about nursing homes. One anonymous, but I'm going to open up Janet Simons so that she can ask what I think is on a lot of people's minds. Janet, are you there? Oh, wrong Janet. Janet Thomas. Janet Thomas, are you there?
Can you hear me?
Yeah, I opened up the wrong Janet. These things will happen. Yes, we can hear you. Go ahead.
Yes, I just wanted to know your thoughts on quarantining nursing homes, because I was thinking about how when the cruise ships, when it was first brought on, they were quarantining the cruise ships so that they could isolate people. And I was thinking, I don't know if we're able to do it as a state, but your thoughts on quarantining nursing homes, because it seems like it just got worse. The spread of it got worse in nursing homes because it wasn't contained in any way.
Well, there have been, first of all, as you probably well know, visitors can't go to nursing homes. They are not letting people in, even husbands and wives or parents can't get into nursing homes. So that quarantine is in place. It's the way nursing homes are set up, it is very hard to quarantine within the nursing home. But to the extent that can be done, it is being done. With regard to the ships coming in, now, once you get outside of the United States, sovereign United States, then the federal government does have a role to play. And we've seen how the ships were treated. I'm sure there's a lot of second guessing about that. Quite frankly, I can tell you, and this goes back, we now are learning that through the intelligence briefings the president had, as early as January 3rd, we were put on notice that what was happening in China was going to come here. So it may be crying over spilt milk, but I think it's not. I think Governor Cuomo said the other day, when we hear that something like this is happening in China, we have to think immediately that it's going to happen here. So what we were doing with cruise ships, I know I had a staffer who was supposed to go on for spring break with her family, go on a cruise. And up until the very last minute, that cruise was going to go ahead. Now they stopped it. A lot of these cruises should have been prevented from launching. But another thing is getting back to the notice we had. Let's say on January 31st, we knew we were going to face the crisis we were going to face. And my view is we knew that much earlier. We could have manufactured more ventilators. We could have manufactured personal protective equipment, gowns, face masks, gloves. There are a lot of tools that need to be used by medical professionals in dealing with this crisis. They are in short supply. Principal example, testing kits. Our governor had to go to South Korea to get testing kits. I think a first world country, the strongest, most financially beneficial country in the world, could have and should have, if they had notice on January 30th, they could have launched production processes. There's something called the Defense Production Act that allows the president to prioritize manufacturing for badly needed supplies. That process could have gone into effect on January 30th. And when it hit us in March, our strategic national stockpile, rather than being empty, would have been filled, and we could have met this head on. I would just say we are now being told there's a second wave upon us, and in the late summer, early fall, we may hit it again. Please, let's get our manufacturing up to speed. So if we get out of the first phase into the second phase, we have the equipment we need, testing, personal protective equipment, ventilators, to respond to the second wave so that it's much less serious than what we're seeing now.
Great, thank you. Alex, another question?
The issue, we have a couple of anonymous questioners also asking about nursing homes. One questioner says she feels powerless to protect family who are in a nursing home, and another asks about the laws or policies governing admitting known COVID-19 patients to nursing homes. What can be done to protect the people who are already there?
Well, let me say my heart goes out because I completely sympathize with the idea of feeling powerless. And again, you can call this crying over spilt milk for those people, but you should make it known to whomever you can make it known to that nursing homes are a particularly serious problem. There are planning, training, and exercise remedies that can be brought to bear to make nursing homes less dangerous. I will say quickly that maybe the way we organize our nursing homes is going to have to be revisited, but even giving the present organization, we can, with enough notice, protect senior citizens and people who are ill. And it's not only nursing homes, it's any long-term care facility in which people are housed to get medical treatment. I cannot give you chapter and verse, but I am quite confident that admissions to nursing homes now are being watched very carefully. And in our business, we talk about alternative site facilities. When the main facility goes down, you should be able to move to an alternate facility within 12 hours. A lot of thought is being given that if a patient presents with a COVID infection, that they are taken care of outside of the mainstream nursing home situation.
Alex, next one.
Okay, we have Lily Jarman Reich. Lily, are you there?
Yes. Whoops, hold on. Yeah, can you hear me?
Yes, yes,
Yes, we can hear you.
All right, wonderful. Well, I have so many questions for you, I don't know where to begin, but the two that I put in the chat, the first one was whether in your work and that of your center, you draw on the expertise in infectious diseases and infection control at the School of Medicine. I know that Mary Claire Rogman, for example, has influenced CDC guidelines on infection prevention in nursing homes. So I'm curious about that. And you also mentioned at the beginning of your conversation, of your talk, that you would have to rewrite the syllabi that you're using to teach how to respond to an emergency because of COVID-19. So I'm interested in some of the changes that will have to be made to those syllabi.
Well, dealing with your second question first, I started teaching the public health emergency course probably in 2005, 2006. Interestingly enough, for 3 years, we co-taught it. We had not just law students, but medical students in the class. One of those students is now a Maryland State Senator. That broke down because of scheduling problems. And when we have more time to think this through, I'm sure Bruce Jarrell and I will discuss that, because I think it is very important for medical professionals, doctors, nurses, pharmacists, even social workers, and that's essentially our campus, to understand and be aware of this problem. Now, what was your first question? I know I went to your second. You wanted to know what use we were making of all the expertise on the University of Maryland, Baltimore campus. Well, first of all, I can tell you over the years, we have worked very, very closely with the Center for Vaccine Development, which is an all-star operation, not just within the state of Maryland, which, by the way, with Johns Hopkins is saying a lot, but an all-star operation nationally. They have been involved in the development, trials, what have you, of every major vaccine that has been developed since the SARS episode in 2003. I work closely with Mike Levine, the former director, who is a national treasure and national asset. Wilbur Chen, who's in that center, is now advising Governor Hogan. So we interact with them a lot. We also have interacted over the years with another rock star institution in the medical school, the Center for Trauma. I'm searching on the name.
Shock trauma.
Shock trauma. Thank you, Bruce. We have interacted with them over the years, quite an extensive amount. And Dr. Pollack, who's now head of orthopedic surgery, was is very big deal in shock trauma. And he and we were on a joint mission to Israel together, studied how the Israelis were dealing with these disasters. So this just says quickly what a great campus we have in the normal world, but especially in the COVID-19 world. On the other hand, I should say that many of our clients come to us that, for example, we were advising the Denver International Airport on how to respond to passengers coming off planes and flying personnel being sick. And we spent about a week 24/7 with them. Now, in that situation, they have access to top doctors. So let me be quick to say, we do not, I certainly would not be opposed to it, but we do not have medical doctors or even nurses on our staff. We would welcome it. But how do we make up for that, as most first responders do, is we rely on the expertise that is either presented to us by our clients or the expertise we find on the University of Maryland-Baltimore campus.
Thank you. Alex, do we have some more questions?
Yes, April Wright is looking for a quick clarification. April, do you want to ask your question?
Ooh, yeah.
Yeah, that's you, April.
Okay, sorry. Okay, I didn't realize I was unmuted. Okay, I'm sorry. I just was wondering, assisted people are, you're talking about nursing homes, and I've been hearing a lot about nursing homes, but my mother is in an assisted living facility, and I'm wondering if I'm not sure how they're different. Are they subject to the same rules? Because I can't go see her.
Yeah,
but I'm just wondering, are they as stringent as nursing homes?
The question you ask is a good one. A lot of people work in this area use nursing homes as a shorthand for long-term care facilities, much as you are presented with a relative in a non-nursing home long-term. The rules that were to go into effect for nursing homes were to go into effect for every long-term care facility in the United States of America. And as I said, the compliance date was in the fall of 2017. We expected to get requests from people because one of the first things they have to do is an emergency operations plan. We can't write those for another institution without that institution's involvement, but we were expected to have clients come and say, we need to work with you. Tell us the A to Z how we do this. And then how do we train our personnel? And how do we exercise? Well, the compliance date came and went, and we heard nothing. What has happened is that auditors who come through who are not informed by the lack of enforcement by the Trump administration are now coming and saying, look, there's a regulation on file. You have to be in compliance. You haven't done anything. So there started to be, in January, February, and March, we started getting calls from nursing homes. And by the way, many of those, this was an unfunded mandate. I think that'll be corrected. But the nursing homes were told to do this on their own dime. There should be federal funds to see that this is done. We had many nursing homes come to us that are, or long-term care living facilities, rehabilitation facilities, come to us and say, we don't have the money. We raised some money ourselves to provide pro bono care for this, but the funds we raised are far short of what we need. We would love to do more. As I said, March 19th, we were having a major workshop with 17 attendees in the Southern Management Building on our campus. And of course, like a few days before, everything shut down. We didn't do it. I'm expecting, God willing, when we get out of this mess, we will have a lot of people coming to us. I am also expecting that Congress will look at these regulations that were never enforced and bring them to a higher level of attention. And I'm hoping that it will not be an unfunded mandate, that there will be federal funds to do all these things. Let me quickly say, hospitals, to be recertified, have to do these things. We run multi-hospital triage exercises. We do them with 13 hospitals at one time in Montgomery and Prince George's County. So the certification process for years has required this kind of planning for hospitals. It had never been required of nursing homes, rehabilitation centers, long-term care facilities. The Obama rule in November of 2016 was intended to say this is going to stop, and within a year, all these other facilities must come up to the levels of our hospitals. It just never happened.
Alex, we got another question?
Yes, we have Cynthia Boyle. Cynthia, thanks for waiting.
Hi, hello everyone. I'm concerned about the rights of healthcare professionals and workers. And, I just wondered what the role of OSHA is in this, and is it really effective? We tend to think of it in a checklist manner, I think. And then the other side of that is we get our professional licenses through our state boards. And I wondered what role you see they're playing, because their stated goals really are to protect the public.
Again, another terrific question. Let me say that one of the major pieces of litigation that we had studied up until this crisis was when the Iraqi war broke out in 2003, there was a tremendous worry that the Iraqis would weaponize smallpox. And there was a major push. It was very clumsily done and never achieved its goals, to have medical professionals revaccinated for smallpox. And perhaps other pathogens that they were worried about being weaponized. A nurses' union in New York State sued the state for the mandate that the nurses, who were not going to go into the harm's way of the Iraqi war, be vaccinated or revaccinated for smallpox. They won that. They won it on a preliminary, temporary basis. In other words, they got it stayed by a judge. They didn't have to be vaccinated for, say, 20 days while the legal issue was aired out in court. But the judge was so emphatic about the fact that, yes, the federal government in certain circumstances, and states and others have extraordinary rights, but they have extraordinary duties to the citizens as well. In the very statutes we have in Maryland that give the governor all these extraordinary powers, they also give rights to citizens. And in some cases, the rights can be enforced by telephone. You don't even have to show up in court, to say that this particular mandate is overboard, it's arbitrary and capricious, and we as citizens, whether done through unions or other citizen organizations, or by the citizens themselves, they can get into court very quickly and say to a court, yeah, we agree governors have powers, but the powers they are using in this instance are overboard. And by the way, when the Maryland courts, for example, closed for the crisis and went onto alternative schedules and distant hearings, they were very clear to say that they would be open for people who felt that the quarantine process was in excess of what the law permitted. And we in fact have prepared briefing books for the Maryland courts on all these issues, so the judges would know if somebody came in complaining that an action was arbitrary, they would know how to deal with it. The fact of the matter is we haven't seen a lot of those cases yet, because I think there is a formed consensus by the public that the actions being taken make sense. But if nurses, well, let me also quickly say, in our Maryland statute, and it's true in other statutes, the governor can force a licensed medical provider to give treatment. What does that mean? Well, the governor can tell nurses and doctors, you've got to go into a highly contaminated environment and treat people in there. Well, what if you say no? They will revoke your license. Now, that could be a very abusive process. So far, thank God, nobody has had to resort to that power. But when I say the governors have extraordinary powers, they have extraordinary powers. but they're not unlimited powers. And there's a body of law, both within the statute and in the common law, that protects the citizens against abuses by the governor or any other medical personnel.
Wow, that's something. Thank you for that one. Alex, got some more?
Yes, we have a number of questioners looking ahead to what's predicted to be another surge of COVID-19. Most of them are anonymous, but I'm going to bring Lily Jarman-Reich back to give voice to some of these questions. Lily, are you still with us?
Okay, thank you. Yes. With the election coming up in November, how hopeful are you that the federal response to the pandemic will be more effective, and particularly that the preparedness measures that are needed for the second wave in late summer that you discussed, that we don't repeat the same mistakes that we did in January by not being prepared?
Well, short answer to that is I am very worried about it. And by the way, just like public health care is by our Constitution given to the states in a foremost way, by statutes and practices, the states really run the elections from state to state. And the Secretary of State usually is the chief officer overseeing that. I know that, well, in Maryland, a lot of attention is being paid to that. And I think throughout the country, a lot of attention will be paid to that. Quite candidly, my worry is that there are some states who may feel, we saw this a little bit in Wisconsin, it didn't work out the way they thought it was going to work out. But there's a view, if we can keep voters away, certain parties will do better. And that is a vicious liability to full-throated protection of the right to vote. It's being touted about. I think the president himself has even said this, that if you allow absentee ballots to be mailed in, that would be deadly for the Republican Party. By the way, I don't like to get involved in politics. Public health, emergency management is, thank God, an apolitical world, but sometimes the politics invade the ability to provide the best public health. So I can also tell you that many people are at work, private groups, to do the very best they can to protect the vote on November 3rd. And the Wisconsin experience is heartening because the view there was if they forced people to come to the polls, that there would be a lower turnout and a certain judicial candidate would do better. And it worked just the opposite. People came out in droves, and the result was very surprising to the political operatives. That having been said, that's a great story, but there's a fly in the ointment. They just reported, I think, 56 new infections that resulted from people who came out to vote in Wisconsin. I think every ability will be made to protect the vote on November 3rd, but it's not something we should sleep on.
One update that I might give to the group is you may have heard Tony Fauci from the NIH National Institute for Allergy and Infectious Disease talk about a drug called Remdesivir that was just in clinical trials. University of Maryland Medical Center was part of that trial, and Dr. Karen Kotloff led the program here at the University Hospital out of the CBD. That particular drug showed some significant results, and in general, it was about a 30% reduction in stay for those who were critically ill with acute pulmonary problems, and about a 30% drop in mortality from 11.5% to 8% during the study. Now, the study isn't complete, The Data Safety Monitoring Board looked at these data and said this was really significant. Let's take a look at this and maybe want to say that this is a positive event. And I think the answer is it is a positive event. And I think you're going to see a transition, assuming availability of this particular drug. It's pretty exciting. Remdesivir, I'm sorry, Patricia. Okay, I had to add a D in there. But in any event, well, actually, there is a D in there. But in any event, that's important. Another thing that's really important, again, to convey to our listener community is that there's a tremendous amount of effort going on at the University of Maryland Medical System and the School of Medicine and UMB to act in a unified command. And we are really attacking this set of problems as one. And that's been a real transition. And I expect Professor Greenberger would say that's one of the most important parts about dealing with a catastrophe. And that is that one hand knows what the other hand is doing and in fact is talking to it so that you coordinate things. So I think we've been blessed with very good leadership during this period of time. And David Marcosi, Wilbur Chen, John Bratt, a whole group of people who have really been tremendous leaders in this whole process. Alex, you said you had another question?
Yes, I'm going to go to Dentistry Dean Mark Reynolds. Mark, are you with us? Can you ask your question?
Yes, I am. Thank you both very much. This is very informative. My question is, in the post-pandemic, what role, if any, do governors and states having in ensuring the rapid adoption of best practices such as PPE in healthcare, perhaps through directives and orders?
That's a very good question. If I could just interrupt my thought for a minute, I just wanted to add on to Bruce's talk about the work of the medical school and our nursing and pharmacy schools. One of the reasons this has been the first of a terrible set of circumstances is that the vaccine was not available or the therapeutic was not available in the early instance. I can tell you a lot of these H1N1, Ebola, the work of the Center for Vaccine Development really cabined what might have been worldwide problems into limited problems. When this first broke, my view was SARS, MERS, H1N1, H5N1, Ebola, Zika, our medical people have always come up with the answer. And I thought the answer would come up sooner than it has. But I have a sense of optimism about this. Remdesivir is certainly a piece of good news for us. It's not a prophylactic. It won't stop it from developing, but it will minimize symptoms. And for one thing, keep people off ventilators if it works. But there will be a vaccine. And that vaccine is, for this circumstance, will hopefully be the end of the trail here. Big problem. Will it be manufactured properly and in the doses that need to be manufactured? Will it be distributed properly? That's the role of the federal government. There's enough worry about that. You see Bill Gates giving billions to ensuring a manufacturing infrastructure, distribution infrastructure. He's not alone. My worst fear is we'll come up with an answer, but not be able to get it out to people. So I just can't say enough about our medical school, the medical center, the nursing school, the pharmacy school, School of Social Work, what terrific work they do, and they have really shown in this environment. Now, Alex, refresh my recollection. What question was I avoiding?
PPE.
Yes, PPE.
Oh, okay. I was quoted, I believe in the Baltimore Sun, saying the biggest surprise to people in the emergency management community was the strategic national stockpile, which is where the feds, going all the way back to the war on terror, had gowns and masks and ventilators and other paraphernalia. They are kept at 6 unknown sites all over the country. And I think going into this, people who work in this field thought that there would be a fully stocked, up-to-date strategic national stockpile. No, the stockpile was, if it wasn't depleted, the equipment had, the value of the equipment had expired and was no longer usable. The shelves were bare. That took care of itself, short of there being a statute or something. And I have been in discussions with our 2 senators about this. I think we need a statute that mandates so that there's no confusion about this, that is the role of the federal government. The federal government is not the first responder, the states are, but the federal government is supposed to provide all the resources for the first responders, the gowns, the masks, the ventilators, the testing kits. And it just, I don't know, the rules weren't clear enough so that people said to themselves over the last few years, hey, we can't ignore this. There should be a rule and there should be a criminal penalty for failure to implement the rule. Yes, I believe a lesson learned from this that will help in the future is that we have to have stockpiles filled with equipment that is not virus specific, like ventilators, maybe testing kits are virus specific, but gowns, masks, gloves, what have you. As to the testing, the World Health Organization in January was prepared to make available to anyone who wanted it, testing kits. The rest of the world took advantage of that. The United States didn't. The United States, the CDC and the FDA said, we're going to develop the testing kits in our own laboratories. And I will never forget this because I was about to go on WTOP radio on the morning of March 1st. It broke that the CDC labs were contaminated where the testing kits were being made. The testing kits didn't work. Now we've got laboratories all over the country developing testing kits, but they couldn't go to work under an environment that said the only testing kit we'll approve is a CDC FDA testing kit. So these are mistakes that I hope we have lessons learned about. I feel confident that in the future, the silver lining here is that we have learned lessons that require diligence. Frankly, I think people who are not trained in this area think, oh, there's an outbreak in Wuhan, China, so what? But as Governor Cuomo said the other day, when we hear there's an outbreak in Wuhan, China, we know it will come here and it will come here fast and we must move quickly. And I couldn't agree more.
So with that, we're out of time. First of all, Professor Greenberger, I want to thank you for a most stimulating discussion. I enjoyed it immensely. Of course, I always enjoy my conversations with members of the School of Law. He pointed out to you that UMB is the home for a number of great schools, and I wrote down what he said because he said medicine, dentistry, pharmacy, nursing, social work, and he didn't say the graduate school, but I am. But I think I want to point out here that you can also see why we have such a great School of Law, because we have minds like this that are thoughtful on interesting questions that are socially responsible and important to all of us as citizens. So thank you all again. Thank you for the participants who were online, and I look forward to seeing you next week. Thank you.